So as soon as we see that record button, we can get beginning. Yeah, we're recording.
All right. Thank you, Giselle, and thank you everyone for attending today. We will get started. So today's session, we're going to provide an overview of the vaccination process at the airport for arriving temporary foreign workers and provide you with some of the resources to support both workers and employers. So we at the Ontario Ministry of Agriculture and Food and Rural Affairs are putting on this session in partnership with the Ministry of Health, the Ministry of Labour Training and Skills Development, Service Canada, and the Ontario Fruit and Vegetable Growers Association. My name is Lori Adrian, and I am part of the COVID Agri-Food Secretariat here at OMAFRA, and I will be your moderator for today. So we do have a number of workers ready to share with you today. And if we pull up the agenda, just kind of quickly for everyone so you know what to expect of the session. So we will have go through some pre-arrival information, so some things to be preparing in advance of arrival at the actual airport. And so we have both Sarah Wilson from OMAFRA as well as Gordon Stock from the Ontario Fruit and Vegetable Growers Association will be sharing some of the information on this area. Then moving on to talking about the actual airport vaccination process itself, we do have Carrie Waring here from the Ministry of Health that will talk about how the actual clinic and the process at the airport do roll out. And then we have Jessica O'Connor from Service Canada on to talk about PCR tests and the quarantine requirements from the federal government. And then back to Carrie again to talk about the process for first and second doses of vaccine. And then last but not least, we do have Ron Landry from the Ministry of Labour Training and Skills Development to talk about the COVID safety requirements post-quarantine. So I won't belabor the introduction, but just a few last housekeeping things before we get started. So the session will take approximately 40 minutes of presentations with the remaining time that's being allotted for questions and answers. We did have a lot of pre-submitted questions and we have attempted to address them directly during the presentation themselves. But if we've missed your question, or if there's some question or comment that comes up during the presentation, please do use the chat function. We will be monitoring it to put your questions in there. We will be responding throughout to the questions that are in the chat function, but also compiling some of them for the Q&A period at the end. And then just finally, if there are some questions that we don't get a chance to get to, we will do a follow-up email to this group on any outstanding questions that have come up during the webinar. Just a last reminder before we get started, we are recording this session and you will receive a follow-up email with a link to the recording and any other key resources. And so with that, I will turn it over to my colleague, Sarah Wilson, to provide an overview of the resources that are prepared for workers before their arrival at the airport, as well as Gordon Stock from the Ontario Fruit and Vegetable Growers Association.
Thank you very much, Lori. And I want to emphasize how important it is for workers to have the information available to them in order to make an informed decision. And this is starting well before the workers arrive at the vaccination clinic. So I want to recognize so many partners that are helping to get the word out around vaccination and providing the information for workers for them to make that informed decision. And starting with Ontario Fruit and Vegetable Growers Association, as Lori has mentioned, will provide some information on the next slide that's coming. Also want to recognize Mushrooms Canada for the work that they have done in reaching out to their members to provide information for workers to be informed. And so many others that I'm sure I would miss if I tried to list everyone here who's making the effort and being really diligent in trying to get that really important information into the hands of the people that need to make the decision about accessing vaccination. So I want to speak specifically about the information that we're providing to the workers as they're arriving in order to make that decision to be vaccinated at the clinic at the airport. So there's a very short but informative package that we're getting out into the hands of the employers and the consulates and many others before workers actually leave their home countries. And one of those pieces of key information is the consent form. It has been translated into multiple languages so that workers know that they will be receiving that or be expected to respond to that when they come into the clinic to be vaccinated. They do need to provide their consent in order to be vaccinated. We are also providing resources from the federal, provincial governments, as well as industry, that are also available in multiple languages, including the fact sheet from the federal government that is focused specifically on what the general public needs to know about COVID vaccines in Canada, and then some tailored information from the Ministry of Health for receiving that actual vaccination, both prior to coming in to receive the vaccination, what's important to know, and also an aftercare sheet. And in addition to that, the package contains the resources developed by the Ontario Fruit and Vegetable Growers Association that are tailored specifically to temporary foreign workers, to provide the information in a way that is culturally sensitive and in multiple languages. And so really trying to find many different ways to get this information out to the workers ahead of time in order for them to review it, to have the conversations with their healthcare providers, for example, in their home countries, to ask the questions before they are coming up to the registration desk in the clinic to register and provide their consent. On to the next slide, please, and I'll pass it over to Gordon.
Thank you, Sarah. Sarah's covered a lot of the information around it's a voluntary vaccine. So, of course, the success of that is ensuring that those that are offered it have full understanding, comfort, and consent in advance of making the decision of whether to be vaccinated or not. And as mentioned, OFVGA has been working on resources for temporary foreign workers over the last number of months, and initially focused on resources related to just general health and safety in the COVID context, to help employers, and farms meet their occupational health and safety requirements during the pandemic. So those resources are available, but also the project has also expanded to the vaccine specific information and in order to help with the employees, temporary foreign workers, make the decision about whether they want to be vaccinated or not. So we've got resources available in English, Spanish, and Thai, and all of the resources that are currently available are on our OFVGA website in, we're referring to it as a poster format or PDF document format, and can be downloaded, printed, provided to workers. And then we're also working through having all of those resources available through a voiceover video. I was sorry, I was just muted there for a second by the system. The voiceover format where essentially it's the same as the document content, but it's provided via YouTube with a narration of the resource to support those that maybe aren't have a lower ability to read the documents or wish to consume it in a more live format. So all of these resources are available to not just fruit and vegetable growers, but really any employer who's looking for resources to support their health and safety plans, or to inform their workers on vaccination, whether it be beforehand when the workers are arriving at the airport, or through through other means at the local health unit level when the time comes. So by no means just because the resources are created and made available through the Ontario Fruit and Vegetable Growers Association, we certainly want to ensure that they have broad reach and welcome other commodities and sectors to be using the resources. So we've been sharing these resources out through our the member associations, like our commodity associations, like the Ontario Apple Growers and Fresh Vegetable Growers of Ontario, for example, and encouraging them to send directly to their farmer members. So the information should be received through those channels, but also have been shared through to health units who are actually putting in orders as we speak around print materials to support local vaccinations, vaccination clinics, and so on. So I encourage everyone to visit the OFVGA website and our OFVGA YouTube channel, which you can access through our website, and to access these resources. And if there's any questions, don't hesitate to contact the OFVGA. And now I'll pass it on to the next speaker. Thank you.
Which actually comes back to me very briefly before it goes to Carrie. So just wanted to highlight some of the logistics and the clinic hours. So you might appreciate that running a clinic at the airport takes a lot of resources to put into it. And so it is not a 24-hour clinic. We are aligning it as best as we can with the large flights that are coming in with the temporary foreign workers, particularly the seasonal agricultural worker programs, workers that are on those flights coming into the Pearson airport. And it is from both terminals that those workers can access the vaccination clinic. The workers that are supported by CanAg farms will continue to be supported in the way that has been already, and we'll just have an extra step in between. So CanAg farms will transfer, or are transferring, because the clinic has been running since April 10th. So the transfer from the airport to the vaccination clinic at Viscount Station, which is a very short drive away. And then after the clinic, where the PCR test and the vaccination are both offered, the workers will continue on to their quarantine destinations. For workers who are local pickups, the arrangement is a little bit different. The transport will be available during those large flights from that correspond, with the large flights, or as part of the large flights. The transport from the airport to the vaccination clinic at Viscount Station will be offered. And so the local pickups then should be arranged at Viscount Station for subsequent travel onto the quarantine destinations. And I would like to highlight here that for local pickups, the drivers should wait for the workers to come out from the clinic. The clinic is a secure location for the dedicated vaccine clinic. So it's we don't have a waiting area at the clinic site for the drivers to come in to pick up the workers. For flights with the smaller numbers of temporary foreign workers on them, we are offering the option, if it aligns with the clinic hours, for that access to have those temporary foreign workers receive vaccination at the airport. We are asking for advanced arrangement through a MAFRA in order to coordinate that with the clinic providers and the scheduling that needs to be undertaken for that, as well as the doses being available for those additional temporary foreign workers to have access. And we are looking for additional solutions to offer vaccinations, but at this time, this is the arrangement that we are offering. Ultimately, our overall goal is to offer vaccination to as many temporary foreign workers as possible at the airport, pending, of course, resources and supply. And this does not remove, of course, that prioritization of the temporary foreign workers and all workers in the local public health regions for vaccination rollout. So if the temporary foreign worker does not choose to have vaccination at the airport, or of course for the second dose, then that would be part of the planning and rollout in the local public health regions. I'm going to turn it over to Carrie now.
Thank you, Sarah. All right, so this portion of the webinar will be looking at the journey of the worker through the airport and the clinic, where they receive both their PCR and vaccination. So this is just a pre-set up photo of the Viscount interior, so a little bit of what it looks like on the inside. And I'll just start by saying some of the key objectives of this initiative are really to reduce the risk of transmission, illness, and outbreaks related to COVID, and also to reduce any interruptions to Ontario's food supply. So one aspect is to ensure protection against the COVID-19 virus by early vaccination. And this ensures that adequate immunity is achieved as soon as possible. So the workers will be receiving, as you heard, the Moderna vaccine, and this takes about 2 weeks for immunity protection to develop. So I'll just start with a caveat there. Next slide. All right, so just a bit before the Viscount building, as Sarah and others have mentioned, prior to departure from the source country, workers are provided with the information package and consent form as described. Again, vaccination is voluntary, and informed consent is really a key priority for us as we go through this process. And in the next few slides, you'll see the various checkpoints that we use to ensure that consent is given freely and informed. So in terms of public health precautions, we do know that once the flights land, a lot of the workers are greeted by either Canadian Travel or other representatives that will actually put them into their cohorts where their final destination of quarantine will be. So those cohorts are maintained throughout the process to ensure that there's no mixing or interacting of cases should there be any symptomatic individuals. The workers will be boarded onto buses according to their cohort, and once arriving at the Viscount station would be entering the Viscount building per cohort. This does mean that some of those workers will be waiting on the bus, but at which time they will again be provided the information package and consent forms for them to review in advance of entering the building, should they not have received the information to review prior to their departure. So you'll see here that the workers will enter the building, and at the top you'll see a security guard is monitoring all of the access points. So here's one station where the security will be. This location is only accessible to authorized personnel for the operation of the clinic and for the temporary foreign workers. So again, it's not open to the public. It's only for the purposes of those operating the clinic. Once the workers enter, they would go towards the, I guess, pink box here, the Ontario Health Registration. This is again a step where the workers will give their verbal consent. They'll provide their paper consent, and it will be entered into the provincial database for receiving the vaccine. The workers would then proceed to the Switch Health registration to register for their PCR test. And again, throughout this process, in terms of public health measures, we do have hand sanitizer stations available, floor decals to maintain distancing. Any seating provided is spaced in accordance with the 2 meter distancing. And of course, the workers are masking, and in some cases also wearing visors. Okay, next slide, please. So here you'll see that the workers are entering the testing and vaccination area and are taken to the various stations. The aerials in this are a bit backwards, but they would first proceed to the right-hand side where the PCR testing would occur. Following that, they would, I guess, shuffle around where you see the second security guard and toward the left-hand side of the second round of stations. And that's where the vaccinations would occur. So again, the workers are asked a series of pre-assessment questions prior to getting their vaccine, and again, consent before they receive that vaccine. Once that is completed, they'll then return back to the main building where they will have a 15-minute waiting period, and it's monitored by a healthcare professional who monitors for any adverse events or reactions to the vaccine. Any workers who decline the vaccine will also will be offered to wait here for the 15 minutes, and at the same time are offered a nutritious meal. I think they're offered a sandwich of some kind, a cookie, and bottled of water. So they can eat here as they're distanced and are waiting those 15 minutes. Following the 15-minute wait, they will then proceed to a checkout, which will give them a printed copy of their vaccination status, in addition to perhaps an email notification. And this is where they'll also receive the package for their day 10 test. So once that is complete, they can actually exit the building and go back to their pre-assigned bus that will take them to their final destination. So just in terms of some of the operations, the first pilot project or pilot run, I guess I could say, was held on April 10th. And at that time, we were processing between 33 and 34 workers an hour. More recently, of course, this has improved. So we're now seeing upwards of 55 workers an hour. And we did hear on one of the days, it was even close to 100 workers an hour. And we are seeing quite a good response from the workers, depending on their source country, of course, but there has been a high degree of uptake for the vaccine from the Spanish speaking countries, which is a good indicator. And on the final slide, here's an aerial view of the Viscount building and the bus staging area. So this is, the green areas indicate where parking is available and drop-off is available. So the drivers can pull up right to the building or wait on the side. And again, we are requesting that no one enters the Viscount building unless otherwise authorized. And from here on then, the workers will complete their required quarantine period. And I'll turn it back over to Omafra.
Thanks for that, Carrie. That was really great. We're going to continue through the agenda. So next up, we do have some information on post-vaccination best practices. Of course, once a vaccine happens, it's not there's still best practices that need to be followed. So Ron Landry from the Ministry of Labor, Training and Skills Development is going to take us through this information.
Sorry, Lori, we have Jessica First O'Connor from Service Canada speaking to this piece.
Okay, thanks.
My apologies. Sorry,
Okay.
I could have jumped in, but I wasn't
That's okay.
100% sure. All right, so thank you so much for having me. So if you want to move to the next slide, I'm just going to advise you about what the process looks like as an employer. So it is your responsibility as the employer to let Service Canada know by email once your workers have arrived at their quarantine location. So you'll want to let us know the name of your business, the locations that your workers are going to be staying at, the date and the number of the workers that arrived, and any contact information that you may have for the workers as well. It's also important, of course, that you're following any requests from your local public health and using any of that guidance as well. Next up, it is important that you are complying with all laws and policies regarding the employer-employee relationship. So that starts upon arrival of the worker in Canada, and it does include that initial quarantine period. So this is going to include their wages. So employers must be paying their workers as per their LMIA, even during quarantine. The working conditions must be consistent with what was outlined in the LMIA, and it cannot allow for workers to provide any duties outside of that contract. Accommodations, of course, must meet the health guidelines. So as the employer, you must provide equipment and products for your workers to be able to maintain clean and sanitary living conditions, and assist your workers in arranging access to food, medicine, and or any basic supplies. So if otherwise, it would require your worker to leave quarantine to access that basic life necessity, then it is your responsibility as the employer to assist with that or help facilitate it. It is important that you're retaining key documentation, so things like timesheets, payroll, contracts, receipts, and of course, facilitate and maintain an abuse-free workplace. So as I've mentioned a couple of times, you are required to be paying your workers during the quarantine period. So it's for a minimum of 30 hours per week at the rate that was specified in the LMIA, the Labor Market Impact Assessment. Excuse our love of acronyms. If a worker does need to be in quarantine longer than that initial 14-day isolation period, because perhaps the worker has become symptomatic or they've been exposed to a person who exhibits symptoms, the worker does need to continue to be paid for the employer by that extended quarantine period. If a worker becomes ill after the initial quarantine period, it's possible they would be entitled to either paid or unpaid sick leave, depending on their employment contract and the relevant federal provincial standards. Of course, they would need to qualify for any of those programs, just like everyone else. But this could include any new provisions in several jurisdictions for job protected leave because of the COVID-19 pandemic. Quarantine wages do need to be paid each time the foreign worker travels and returns to employment for the first 14 days. So if one of your workers leaves Canada for whatever reason, vacation, something like that, when they quarantine upon return, those wages do need to be continued to be paid. All right, so continuing along with your responsibilities. Oh, sorry, if you can go back one slide, maybe? I'm not sure. We'll see. So it is important that you continue to monitor the health of workers who are in quarantine, as well as any employee who becomes sick after the quarantine period. That's the right one, thank you. If a worker becomes symptomatic at any time, or if there is a COVID outbreak, make sure you're reaching out to your local public health unit right away. Above and beyond that, please email Service Canada, the email address you see on your screen there. And make sure you're letting WSIB, so Workplace Safety Insurance Board, know as well. Next up, so Switch Health did create a dedicated call center and an email channel for employers of foreign workers. We recognized, of course, that there was an increased demand there. So that's available across Canada where the services are provided by Switch Health. So day 10 test scheduling, it is important that you're scheduling that day 10 test as early as possible. So ideally within 48 hours after your workers have arrived, just to make sure that there's no delays in making sure that this test gets administered to your employees, and to minimize the amount of time employers have to wait to schedule those tests. So if you need to set up a day 10 appointment, you can reach out to the email address you're seeing on the screen there. As I said, that's dedicated specifically for employers of temporary foreign workers, or you can be calling the phone number you're seeing on the screen there as well. And as I understand that will likely arrive in an email to you afterwards. So Switch Health has also created account managers that will be assigned to employer accounts. So that will be your lead point of contact for all inquiries moving forward, just to make sure that you as the employer have support as you move through the process. So an account manager will be set up and will be in contact with the operational lead at your location within 24 hours after setting up a Switch Health account. And if you are an employer who already has a Switch Health account, but you don't have an account manager yet, please make sure you're emailing Switch Health, so TFW-Canada@switchhealth.ca, or of course, feel free to give them a call. And just a note, because this was one of the questions that came in before, even if a temporary foreign worker is vaccinated at the airport, they will still need to get and do the day 10 test. All right, so we're going to stay on this slide for just a minute. The operational lead feature, so this will allow an employer to add multiple foreign workers to a single account. So just to assist in managing all of this, the tests and the results. So the operational lead for your company will receive an online, a link to an online booking form directly from your account manager. So that piece at the beginning to make sure that you've had an account manager assigned is an important one. There are Spanish-speaking services available through Switch Health as well. So just make sure you're letting your account manager know if that's something that you will require. So when you go ahead and start doing your test scheduling, just make sure you're letting them know about that as well. There are also Dropbox locations. These should not be used on the weekends. If you need to have a pickup arranged, you'll want to do that with your account manager if over the weekend is when you need something to be picked up, and a third-party courier will look after that. So there is also mobile testing services. So Switch Health is, of course, going to attempt to facilitate phone or video service. That's going to be much quicker, but on-site testing is also available, and there are mobile testing services if you need support directly on farm for the administration of those day 10 tests. Important note about labeling. So use the label in the collection kit, write the first and last name and date of birth on each label. So this will likely be done by your workers. Make sure that's clear to them. So first name, last name, date of birth, and make sure it's not going around the tube. Make sure it's going a long ways across the tube. That will just help to prevent any delays in the processing of it. So it is possible that Switch Health information was shared to you already via email. If not, it is possible you'll receive that information following today's session as well. And that is all I've got for you. Thank you.
Thanks, Jessica. We're going to go back to Carrie now to talk about the process for the second dose or for first doses for workers that are already in Ontario.
Yes, thanks, Laurie. So in terms of the first dose, in accordance with the phase 2 of Ontario's vaccine implementation plan, the vaccination clinic at Pearson Airport is only serving temporary foreign workers, as these workers are at a higher risk due to the living and working arrangements in what we call these high-risk congregate types of settings. As well, in accordance with phase 2 priority planning, local public health units will also be working with employers to vaccinate temporary foreign workers that are currently in Ontario. But I do want to note that due to the variance in vaccine supply and capacity, local public health units may be at different stages in their ability to offer the vaccine to this population at the local level. So again, if the workers are willing to get vaccinated at the airport, this is the best line of defense to prevent transmission on the farms. But when it comes to the second dose, those who have received a first dose, either at the airport or through local public health, their data will be entered into the provincial database, and this ensures monitoring and tracking of their immunization status. For now, we know that the second dose will be offered through the local public health unit in accordance with the provincial vaccination plan. Operationally, for health and safety and administrative purposes, it would be helpful for the employers to track the vaccination status of their workers and be in contact with local public health should there be anyone who maybe did not consent at the airport but changes their mind, or if you are getting close to that second dose timeline, that communication with the health unit will be quite important. But again, as I said, the rollout at the local level is in different varying stages. So be mindful of what stage your local health unit might be in and when they will be able to offer those doses to temporary foreign workers. And that is all from me. Thanks.
Thanks, Carrie. So this time I really will turn it over to Ron Landry from the Ministry of Labor Training and Skills Development to talk about post-vaccination best practices.
Thank you, Laurie. We can just advance the next slide. So the key component of the Occupational Health and Safety Act is the internal responsibility system. And the Act makes it clear that employers have the greatest responsibility with respect to health and safety in the workplace. However, everyone in the workplace has a responsibility for promoting health and safety and to help work in compliance with the Occupational Health and Safety Act. And there's the link provided at the bottom, which takes you to additional information on the internal responsibility system available on our website. And a copy of this presentation will be provided to everyone. So the internal responsibility system means that everyone in the workplace has a role to play in keeping the workplace safe and healthy. So workers who see a health and safety problem in the workplace have a duty to report the situation to the employer or supervisor. And employers and supervisors are required to look into the issue and ensure that the farming operation addresses any hazards. So the key is the proper functioning internal responsibility system. Properly functioning, properly supported, provides the greatest level of protection for workers, greater even than an inspector attending the workplace. And what I mean by that is, if an inspector was to attend and find a contravention, they'd write an order for the employer to come into compliance, which would mean meeting the minimum standard as prescribed. The same hazard could be recognized through the internal responsibility system. Say, for example, the Joint Health and Safety Committee, they could make a recommendation to the employer to address that hazard to a level that exceeds the minimum standard. And if everyone agrees, the employer agrees, they move to that higher standard. So the greatest level of protection for worker health and safety is a proper functioning internal responsibility system, everyone working together. Next slide, please. So everyone has responsibilities under the Occupational Health and Safety Act. Some of the key employer duties are taking every precaution reasonable in the circumstance for the protection of a worker, to provide, maintain, and ensure proper use of equipment, materials, and protective devices, to ensure all required measures and procedures are carried out, to provide information, instruction, and supervision to the worker, and to acquaint workers with and supervisors with any of the workplace hazards. Next slide, please. The workers have their own rights, of course. They have the right to know about any hazards that they may be exposed to. And employers are legally required to provide information, instruction, and supervision to all workers and supervisors about known health and safety hazards in the workplace. And it may include translating this information into the worker's first language. Workers also have the right to refuse unsafe work, and employers are not allowed to fire, discipline, or penalize a worker for following workplace health and safety laws or refusing unsafe work. Workers also have the right to participate in identifying and resolving health and safety concerns, including issues related to COVID-19, for example, through membership on a Joint Health and Safety Committee or as a health and safety representative. Next slide. Of course, workers should follow the safe work procedures and the requirements of the employer's health and safety policies. And workers should also be aware of and follow public health directives and guidance issued by Ontario's Chief Medical Officer of Health and the Ministry of Health. And there is a link provided for the most recent information. And if a worker becomes ill due to COVID or experiences any symptoms, the worker should report to a supervisor immediately so that others can be tested and further controls can be put in place to prevent the spread, not only within the farm, but within the local community as well. And of course, with any hazard, if a worker sees anything that looks unsafe, they should tell a supervisor or employer right away. The worker may also wish to speak to a Joint Health and Safety Committee or Health and Safety representative. Next slide, please. So the ministry has a guide for employers to help develop a workplace safety plan. Whether you're currently operating or planning for your workers to return to work, the guide will help you develop a plan to work safely. It'll help prepare you to put controls into place to make the workplace safer for everyone. Now, there is a template available through the link provided. It's not mandatory that you use this template, but it's a great resource if you're looking for assistance, or even maybe you have a template and you just want to compare it to something else just to see that you've ticked all the boxes and covered everything. So as quickly as possible upon arrival, workers should be instructed on the farm's safety plan in a language that they understand, for example, as part of their orientation training. You can also check the resources to prevent COVID-19 in the workplace for sector-specific information and examples of controls that apply to your workplace specifically. So there's over 200 workplace-specific guidance documents available through that link. Next slide, please. So joint health and safety committees and health and safety representatives. So a joint health and safety committee is required when there are at least 20 regularly employed workers in the following farming operations: mushroom, greenhouse, dairy, hog, cattle, and poultry. And farming operations that regularly include more than 5 workers but are not one of the 6 specified commodity groups are required to have a health and safety representative. Just on the note of regularly employed, because obviously workplaces fluctuate throughout the year, we look at a 3-month average as far as making this determination. So the duties and responsibilities that are shared by both Joint Health and Safety Committee and Health and Safety representatives include inspecting the workplace at least once per month, identifying workplace hazards, making recommendations to the employer, obtaining information from the employer regarding identification of hazards, inspecting the workplace and investigate following critical injuries, fatalities, or work refusals. And they have the opportunity to accompany a Ministry of Labor Training and Skills Development inspector during inspections of the workplace. In addition, Joint Health and Safety Committee members meet at least once every 3 months and keep minutes of their meetings. And certified Joint Health and Safety members may initiate a unilateral or bilateral work stoppage if they believe that dangerous circumstances exist. So, many people have heard of work refusals, where an individual worker refuses unsafe work. Unilateral or bilateral work stoppages are where the certified member stops work because they believe a dangerous circumstance exists. So a certified member can initiate that without having a worker refusing. So it's just another power that the certified members have. And it's nothing new, it's always been there. Pre-pandemic, very seldom ever used across the province in the course of a year, but it has always been on the books. Next slide. So in Section 50 of the Act, there's prohibition against reprisals. So employers are not allowed to reprise against, punish a worker for obeying the law or exercising their rights under the Act. So the employer cannot dismiss or threaten to dismiss a worker, discipline or suspend a worker or threaten to do so, impose or threaten to impose any penalty upon a worker, intimidate or coerce a worker for work within the requirements of the Occupational Health and Safety Act and its regulations. In a circumstance, a worker may feel they've been reprised against, they can call our call center or email the WebOsh address provided to initiate a reprisal complaint. The role of an inspector in a reprisal complaint is not to make a determination as to whether or not the worker is reprised against. The inspector will look into any health and safety natures, any health and safety related issues around the reprisal, making sure there's no contravention to the Act or the regulation. And whether or not the worker was actually reprised against would be a determination of the Ontario Labor Relations Board, which is an independent arm's length division of the ministry, and they have powers to order remedial actions should they determine in the course of investigation that a worker was reprised against. And if the worker wishes to pursue that avenue, the inspector can help forward the complaint to the Ontario Labor Relations Board. Next slide, please. So in 2021, we have our farming initiative strategy. So recently we've experienced new positive cases and outbreaks on farms in certain areas. And as part of our outbreak management response, we will continue to conduct targeted inspections in 2021. So our initiative this year, as you know, we did it last year. This year, the intent is to raise awareness and compliance among farm workers. Sorry, just had something pop up in the middle of my screen. Raise awareness and compliance amongst farm workers, supervised employers about COVID-19 health and safety requirements, enhance protections for temporary foreign agricultural workers living and working on farming and agricultural operations in the province, increase compliance with the Occupational Health and Safety Act and applicable regulations in the farming community, and to help stop the spread of COVID in the workplace and the surrounding communities. Next slide, please. So we're using the existing general duty sections of the Occupational Health and Safety Act 25(2)H, requiring employers to take every precaution reasonable in the circumstance for the protection of a worker. This includes a focus on screening to prevent workers who may have COVID from coming to work, physical distancing and 2-meter separation, proper on-site hygiene, which would include cleaning common touch surfaces, engineering controls, and other precautions, including the use of personal protective equipment. The ministry also employs a team of specialists that may accompany an inspector, such as engineers, hygienists, doctors, ergonomists, and radiation experts. And they may also bring or make referral to Service Canada, and or the local public health unit as deemed appropriate. So for example, where the workers are housed, that's considered a private residence. We don't have any authorization to go in there or to address contraventions or issues in that area. So we may make a reference, for example, to the local public health unit. And of course, we have our Health and Safety Contact Center that you can call anytime to report injuries, fatalities, or work refusals. You can also call 8:30 to 5 Monday to Friday for general inquiries. You can use the number provided. You can also email to the WebOsh address provided, and you'll get a response within 5 business days. And of course, in emergency situation, always call 911. Next slide, please.
All right, thank you very much, Ron. This has been great, and a lot of information has been shared today. We do have several questions that have come in, so we will go to a question and answer period now. Just to give everyone a heads up, we will go a little bit past 1 o'clock in an attempt to get through as many of these questions as we can. But if your question does get missed, we will do a follow up with any questions after we wrap up the session. So I'm hoping my panelists are ready to jump in with some of these questions. The first one that's come in is asking if there is anything that we can do to convince workers that are unwilling to accept the vaccine. And I'm going to put Sarah and Gordon on this spot a little bit on this, because I know they've done a lot of good thinking about how we can address issues of vaccine hesitancy. Maybe I'll go to Sarah first and then Gordon.
Thanks, Laurie. Yes, it's, like all of us, vaccination is a voluntary and personal choice. That being said, all of us, if you can put yourself in the shoes of anyone who is having to make that decision, certainly benefits from information, factual information about vaccination and the implications of having a vaccine in terms of protecting themselves, protecting close contacts, protecting the community. It is one tool in the protection and the protection of health and safety of workers. So it is a very important tool, but making, sorry, that's not right, the right word. My brain's stuck on that. Offering, shall I say, the information that someone really needs to make that informed decision is really critical early on. So ensuring that it's in the hands of workers as early as possible so they have those opportunities to ask questions and to consider that choice for them. So it's not about compelling, it's about informing and supporting everyone in having the information that they need to make those decisions. Gordon, I'll turn it over to you.
Thanks. I'll just briefly add that in observation of the initial the pilot at the airport on the first day of vaccination, that when workers were given the package and well, in this case it was a flight from Mexico, and they were given a package in Spanish, and it was quite obvious that they appreciated the information, and we saw sort of an improvement on their willingness after that point. So it definitely need to have it available, the information available through multiple touch points where possible, and then again it's being provided at the airport and so on. So I would offer that. From an employer standpoint, anything you can do to share the resources, that would be the single best thing you could do on that front.
Thanks, Sarah and Gordon. And Sarah, the next question is for you, so don't go too far away. The question is, has this information been given to the consulates for the workers as well? We have workers who have cell phones, but not printers and computers. And is there a place for them to get the information in advance?
Yes, certainly. That we have been working very closely with with the consulates and with many others to get the word out to workers prior to their departure from their home countries. Recognizing too that needed in different formats and different mechanisms. So the information is all available online, and there will be, I believe Giselle is distributing information after this with links, and also printed format at the airport vaccination clinics, so that even those, you know, who haven't had the opportunity to access it through other means will have it in hand. So we are seeing it as very important, and as Gordon has previously emphasized as well, a different mechanism, different means over time, as many different ways to get the message out as possible to be sure that everyone who needs that information can have access to it.
Thanks, Sarah. And maybe just one thing that I will add, because I know a lot of thought has gone into making materials that are appropriate for workers, and also reflecting some of the cultural and historic things that may be causing barriers for adoption of vaccination. And there is certainly a lot of history and other factors that the team has been considering and is learning from and tailoring as we go forward with this program, because there certainly is everyone comes at it from a different perspective. I'm going to go on to the next question in here, and we have a few that are more targeted towards some of our colleagues with Service Canada. So the next question is there a possibility that in the future of the temporary foreign worker program that workers will be required to have and show proof of a COVID vaccination so they can come to Canada? Is there something from Service Canada on that? Thanks,
yes,
Jessica.
No problem. I really can't speak to that. I think at this point it would only be speculating. So I will defer to any colleagues if they have any more insight than I do. But at this point, we don't have any knowledge of that. Thanks,
Jessica. So don't go too far, because the next one is also coming your way. What is the protocol for a seasonal ag worker program worker who has been vaccinated in Mexico? Do they still have to get tested and do their day 10 test?
I may defer to Jordan for this one. We do have someone from Switch Health here. I believe that the answer to that question is yes, that they do still need to get tested, but I'll sort of wait and see if Jordan can answer or agree or disagree with that.
No, that's accurate. We're still testing people even if they're vaccinated. My understanding of the federal order is that we continue to test regardless if people have been vaccinated or not.
Thanks, Jordan. All right, the next one is, Carrie, is coming your way. So this is related to the second dose of the vaccine, and it's asking, do we book seasonal ag workers to receive second doses of vaccine at local vaccination clinics?
Thanks, Lori. So I guess the short answer is yes. We are hoping that the employers will play a role in monitoring and booking when those, I guess, 4 months approximately are due for the second shot, though there may be other delivery channels that may be open at that point in time through pharmacies or other clinics, but that is yet to be determined, but we are looking at all options.
Thanks, Carrie. And then the next one, again, Carrie and Jordan, I'm going to put you on the spot for the next question. I've heard that workers arriving that they have not eaten since early in the morning on the day of their travel. They're hesitant to get the vaccine shot on an empty stomach. Can anything be offered to them so they feel more comfortable? Sounds like the food is being offered after they decline the vaccine and are waiting for 15 minutes.
I guess I can start here. So that is also a concern of ours as well. We did note that, you know, low blood sugar levels could result in uneasy feelings after they get the vaccine. We took a lot of time and care to look at the process through the airport and through the transportation and try to find a designated area that would be safe for the workers from a security standpoint, but also so that they can maintain their public health precautions in the safest way possible when they are unmasking to eat, with trying to avoid social gatherings and being grouped together, as sometimes eating is a social activity. So as mentioned, a lot of thought and care went into this, and it was determined that when they are sitting in the Viscount station 2 meters apart, that seemed to be the safest route that we could provide that meal. And I'll let Jordan also add if he has anything further.
Sorry, looking for the mute button. No, that's great, Kara. That's very helpful. Any of these other process questions, I'll certainly take it back as well to the rest of the teams. That's valuable feedback. Thank you so much.
Thanks, Carrie and Jordan. So the next question is asking about translation and languages that translation is available in at the clinic, and wondering if there is a translator available in Thai at the Ontario Health Registration for testing and vaccination. So I'm gonna put Jordan on the spot on that one to speak about the languages that Switch does have translators available for.
Sure, we do. Our guides are available in 15 different languages. I mean, some of our staff speak up to 25 languages, but no, we do have Spanish resources available on site as well. In addition to translation on standby and ready to go. So if we do notice any gaps, by all means, please let us know right away so that we can add some more resources there too.
I will maybe just add on that if you are aware of workers coming in at a certain time that have other language needs beyond English or Spanish, if you could reach out to OMAFRA in advance, and we'll certainly make sure to share that with Switch so that we can just double check that we're prepared for that. The next question, and I'm going to go to Carrie for her advice on this one, is if all workers of one farm arrive and all have previously informed us that they prefer to wait to get vaccinated later at the local health unit and decline vaccine at the airport, can they proceed directly to their quarantine location without going to Viscount? It's Carrie, I'm just wondering if you can maybe break that into a couple different pieces. First, about the advice, if that is what workers want to do, and what advice we would be providing them, as well as some kind of logistics about the way it works actually at the airport itself.
Thanks, Lori. So as shared during this webinar, consent to the vaccine is a voluntary and personal choice. It also requires fully informed consent. So if the worker does not feel comfortable consenting at that point in time, they may be offered the vaccine at the local level. That being said, I think all of us here are working very hard to make sure that fully informed consent can be made prior to the Pearson vaccination clinic, because as I mentioned, the earliest that you receive that vaccine, the earlier you'll be protected from the serious symptoms of COVID and potential transmission on farm. But when it does come to the logistics, the workers would still proceed to the Viscount building, particularly for those larger flights, to receive the PCR testing. So that will be the flow through process for receiving that PCR test.
Thanks, Carrie. Moving on to the next group of questions. So this one relates to arranging third-party transportation to the farm after the testing and vaccination. And is there a contact number or email when all workers are done in a group to inform the driver, and how long is the process? And Sarah, I'm going to put you on the spot again on this one, just to speak maybe generally to how long the process can take, the variation in the timing of the process, as well as how drivers can connect with workers when they come out.
Thanks. I'm pausing to get off mute because for some reason the ground service in my condo building has decided now is the time to mow the grass directly outside the window I'm sitting in front of, so I apologize for the background noise. The flow through of the airport, as Carrie has mentioned, it has increased to somewhere upwards of 55 workers per hour, or even higher levels, depending on I guess the conditions in the clinic at the time and how quickly workers are making that informed consent. So it is hard to predict, I would say. It depends on the size of the group that's going through, and it does. I don't know if Jordan might be able to add some more details to that, or Carrie. I'm not sure about how to predict how long the actual process will take for a worker who has local pickup.
Thanks, Sarah. Jordan, is there anything you wanted to add on that? Just in terms of length of time to go through the clinic.
Oh, to go through the vaccine clinic. That I will check back exactly on that for the pickup arrangement. I'll be honest, I've been more focused completely on the testing side. I could have brought somebody in, I guess, in the vaccine part too. But yes, let me follow up and try and get an answer for that just before the end of this.
Okay, thanks, Jordan. Well, glad to hear that you are focused on the testing side, because we do have some testing questions that are in here as well. The next question is looking for some clarity around the assigning of account managers on the farm, and just wanting to know about the timing of this and whether that is kind of been broadly rolled out. So Jordan, are you able to speak to that question?
Yeah, so just to clarify on that, I think I responded to this in the chat as well. I think there might have been some confusion about some operations thought as soon as they registered an ASMO account that someone would automatically reach out to them. But if we kind of follow through the guide, the first step should be to reach out requesting the appointment time, at which point then an account manager or designate would be in touch to confirm that. So the first thing you should do is definitely register the ASMO account, put in all the workers as dependents, assign their serial numbers to the accounts just so that it's all registered and ready to go. One of the biggest issues still remains the mislabeling of serial numbers and samples. So we just want to make sure that that's all set. And then once you reach out to request an appointment, you'll have somebody assigned at that point.
Thanks, Jordan. There's a couple questions in here for Service Canada next, and I'm not sure if we have the right people on the line to be able to speak to them or not. But there is a question about access to CERB and CRSB payments, and the timeliness of those payments, and if there can be a way of kind of facilitating that to happen in a more timely manner. Jessica, are you able to speak to that?
I am, yes. So it's a fairly simple question, and I'm about to give you a lot more information than I'm sure you wanted. Janet, I believe, asked the question. So you were asking about sort of the emergency payments, essentially. So in respect to your temporary foreign workers who are arriving, and as I mentioned, they could be eligible for benefits. They, of course, have to qualify, same qualifications as everyone else. So currently, the benefits available would either be through CRA, Canada Revenue Agency, and that would be the Canada Response Sickness Benefit, would likely be what you're talking about. But the other path to some of those benefits would be employment insurance. Of course, you'd have to have worked enough hours in order to qualify for employment insurance. So right now it would be about 420 hours for regular, or I believe it's a 600, I can't remember now off the top of my head, in order for this to qualify for the sickness benefits. So I'm guessing likely what you're asking about is related to the CRA, the Canada Revenue Agency benefits that were put in place as a result of all the people having to get money, but not necessarily be qualified for employment insurance. So in that case, it isn't Service Canada specifically. However, we have taken note of it. My colleagues have already been chatting about it in the background. We will, I'm assuming information is going out afterwards. So I do have some phone numbers in front of me here for CRA. We will also share them in the chat box. I know my colleagues are on that. But we will also take that feedback back to us. I'm not sure about assigning someone specifically to those claims, and I'm truly not certain what the process looks like for CRA right now and getting access to that money. And so that's a harder one for me to speak to, but we do appreciate that feedback and certainly can recognize that it has a broader impact. So thank you for that.
Yeah, I just wanted
to... Thanks for that, Jessica. And sorry, Janet, I'll give you just one moment, but I do want to get back to talking about vaccination and testing. So if I can I loop back to you again at the end and we'll catch up with your question there. I just want to get through the vaccination and the testing questions that are on. I hope that's all right. The next question does though relate to questions around day 10 test and just looking for some clarity on when is day 0 of day 1 testing, of day 10 testing, sorry. And Jessica, I'm going to put you back on the spot again from Service Canada, if you're able to speak to kind of the which day is day 1.
I'm hoping Jordan may step in to assist me.
Day 1 is day 1. Day 1 is day 1 from our perspective, and I believe from the federal government's perspective. I know there's some local health units that treat day 1 as a day 0, but from our perspective, day 1 is when they arrive in the country. So that's the first day, not 0 day.
So arrival day is day 1.
Arrival day is day 1.
Thank you. So the next question, and Jordan, I'll keep you on the spot on this one. It's related to timing of getting test results back and some kind of questions about the length of time that it takes to get test results back through. I'm going to read through this a little bit more, that this is related to the day 10 test as well.
So just as far as some of the delays, generally, I mean, if the courier picks things up on day 10, there shouldn't be much of an issue. I think there was a big influx last week, and we have been adding more staff and more laboratory partners to meet the demand. We're also looking at potentially adding, laboratory partners specifically down kind of in the Southern Ontario region to help with some of that demand. I don't have a further update on that this second, but it should be coming soon. I think we've made strides in the right direction for sure, recognizing that we really do want to get this all done fast. So I think it's important that if you reach out early, schedule the appointment early, if everything's registered, ready to go, the appointment goes fast. That helps a lot, and the ensuring that the serials are registered properly is really important as well, so that we don't want to get any inconclusive results back and have to redo the tests, just because that obviously extends things a little bit longer. And I think that's one of the main reasons why some quarantine times have been extended. So just in order to avoid those unfortunate circumstances, we just want to make sure that everything's registered properly.
Thanks, Jordan. So there's 2 questions that I'm going to loop together next and ask Carrie if she could weigh in on. The first one is related to the timeline for the second dose, so how long after the first dose. And then the second one is asking about access for workers who have already arrived and whether they should go to the airports to get their first test. I'm going to throw in that if you can just speak a little bit to what they could do also in the region.
Thanks, Lori. Yeah, so the clinic at Pearson is currently only operating for those that are arriving per the scheduled flights. But if you do have workers that are currently here, or as I said previously, if they didn't consent at the airport but would like to then get the vaccine at a later time, to contact your local public health unit to determine what arrangements can be made. And the timeline between the first dose and the second dose is about 16 weeks. And I know Robert's here, so correct me if I'm wrong, or if you have anything else to add.
No, the timeline that we're using right now is 16 weeks. There are specific groups in the province right now that that time frame is the shorter time frame per product monograph. But we are, in general, using a 16-week time frame for now. That could change over time as we learn a little bit more and as things evolve with our rollout of our programs. So that is something that information could change on. If that does change, local public health units will be sort of well versed in that. And if there are, I would also say that if there are folks that are going back before that current 16-week period, that's also another good reason to reach out to the public health unit to discuss those situations, assuming that won't be the majority, but a reach out to local public health unit would be good on that one too, in case somebody would be going back before that 16-week period to discuss sort of what that option or what that could look like for them. But right now it is 16 weeks.
Thanks, Carrie and Robert. So I just have one more question, and then I'm going to loop back to Janet's questions that she wanted to talk about with SAWP payments. But the last question, and again, I think it's a Carrie Robert question. For signing up for vaccinations at the public health unit, does that happen just the same as others, or will health units be reaching out specifically to the farm?
Carrie, do you want me to, or do you want to?
You can go ahead, Robert. Yeah.
I would say once again, as Carrie mentioned, I would say an active reach out on your part would be a great idea to the public health units, so that it can be sort of more timely, because it will vary. Some health units are doing active reach out, and others probably might not get to that right away. So I would say an active reach out would be the best approach on that one to the health unit, to talk about how best to register and get that organized.
Thanks, Robert. And Tanya's just telling me that I'm completely mistaken in saying that we're almost through our questions. There are a few more of them. So sorry, Janet, you have to hold on a little bit longer. But this question is asking about the language of confirmation of vaccinations. Is it only in English, or is it available in other languages? And is there something that workers could take to document back when they go back home to their home countries? Carrie and Robert, I'm going to keep you guys on the hot seat on this one.
Robert, you can feel free to chime in, but because it's an Ontario-based provincial database, to my knowledge, it's primarily offered in English and or French. But Robert, correct me if I'm wrong there. I think those are the two primary languages.
Yeah, the receipts are coming out that, as you say, Carrie, that way. But I think that may be an interesting one to follow up on as sort of we move forward with the program. Yeah, and especially if we're giving one dose or those with 2 doses and that sort of stuff. So I think that requires a bit more follow up, and yeah, we can get some information out maybe on that one, because I think it may be important. And that might be some discussions, Lori, with consulates and those sorts of things also, to figure out what is the best approach for those receipts, because folks might lose those too by the time they're ready to depart. So we do want to make sure that if they are even leaving with 1 dose, that they have the accurate information to complete a series in their own country, potentially. So.
Thanks, Robert. Looks like we still have a number of questions that are geared towards my Ministry of Health colleagues. So the next question is related to prioritization, kind of outside of the workers who are arriving at the airport. So this one is saying that our health unit is not vaccinating any temporary foreign workers that don't live in company provided housing. Will they be added to the prioritization when appropriate?
That's a good question. So in accordance with the phase 2 rollout, those that are living in congregate settings are prioritized before those that are not. That being said, essential workers, particularly in food and manufacturing, are also part of the phase 2 rollout, but are more of a secondary priority. So as I mentioned, different health units are at varying stages of their ability to offer the vaccines to certain groups. So you just might have to stay tuned to what the local rollout is. And when you do get that indication that you are getting closer to those priority groups, then we advise that you contact the health unit to obtain further information.
And thanks, Carrie. The next two questions, I'm going to loop them together, and I'm not sure whether we're able to answer them kind of directly as asked, but maybe to give just a little bit of context to the thinking on it. So the first question is related to temporary foreign workers that have been vaccinated in their home country, and how will they be considered? Would they need to have confirmation letter or something to demonstrate that they have received their vaccine? And then the next one is related to individuals who are scheduled to leave or go back home to their home countries prior to the 16-week time interval. And how would that fall for receiving, for example, a second dose?
Well, I'll turn this one over to Robert, if you're able to address this question.
Yeah, hi. So on the second question there around the 16-week interval, as I mentioned, sort of the best reach out would be the local public health unit if somebody is going back early, so that can be sort of discussed in an approach sort of developed locally around that one. So reach out to public health unit, best approach on that one. And I do apologize, Lori, I missed the first question. I was multitasking.
Thanks, Robert. The first question was asking about workers who may have received a vaccine in their home countries, and if they need to have some kind of documentation to demonstrate what vaccine they received.
Yeah, so if somebody, and that's a good question, when reaching out to public health units, to also sort of pose to them, because there may be some differences locally in terms of how that's implemented. You know, the provider who's actually doing that should be asking if there is proof that somebody could see. That would be the best piece to make sure that we know exactly what dose they might have received for that first dose. Current recommendations are not to mix products. You're supposed to follow your series completion with the product that you start with. So to the extent possible, that is what we would want to do. So any documentation that would be great, but providers are sort of versed in sort of trying to figure that information out to be able to complete that schedule as needed. But I would once again, local public health units are sort of well versed in that in terms of trying to figure out sort of then series completion also if there is lack of information there.
Thanks, Robert. Couple questions are in that are related to transportation. So if a farm has only 1 or 2 employees arriving on a specific date, can the farm arrange their own transportation of the workers to the quarantine location? And then another question related to in Norfolk, where private transportation is being arranged, is there a need to go to the Viscount station to get the day 10 tests after a flight arrival, and how should transportation be arranged in those circumstances? Should they be picked up at Viscount? And Sarah, I'm going to go back to you, because I think you've touched on a few things about how things work in terms of arranging transportation from Viscount.
Thanks, Lori. Yes, it's the Viscount station is the location for the local pickup for those workers that are going to the vaccination clinic. I'm putting in that caveat because we are working around options for how workers might have vaccination access if they don't come in on one of those larger flights. So as mentioned in the presentation, if the timing corresponds to when the clinic is open, that is certainly the location that the workers should go to access all components, the PCR testing, the vaccination, and the day 10 test is being provided at that site as well. So it's a all-in-one stop, shall we say, and then the local pickup should be from the Viscount station. And we'll need to figure out how to identify the timing for that, one of those questions that came up previously, but I would say that it's probably a faster process for the temporary foreign workers to go through that dedicated spot, all-inclusive type of process. So there's not, you know, the different steps along the way, and access to you know, it's access specifically to temporary foreign workers. So it's not accessible and open to other travelers that are coming into the airport. It's more information than you asked for, but I hope that's helpful.
Okay, I'm just going to do just a couple quick questions, as I know we are running out of time and likely to get kicked off of the webinar. But I think they're common questions that probably a lot of folks have. So the next question, and Jessica, I'm going to look to Service Canada on this. After day 14 of isolation, can a temporary foreign worker work even if the test results have not been received?
I was checking my notes through in my previous presentations to confirm this. It was my understanding that they had to have a negative day 10 test result in order for them to proceed. I'll see if anyone chimes in with any information to counter or contradict that. But as far as I know, they have to have a negative day 10 test result in order to go ahead and start working.
Okay, thanks, Jessica. And I'm going to keep you on the hook for the next question. And this one is looking for clarity on the protocol for workers who test positive at entry, particularly around checking in and monitoring of those individuals.
Yeah, so I did see that question come in, and I don't know that I have enough information to speak to that. It was my understanding that the day 10 test results were still required in order for them to start. And so the daily monitoring through ArriveCan, I know there was an app that they could be using for ArriveCan, but I don't know if it was daily. So yeah, I'm not sure I can speak to that. I'm hoping maybe we can gather some information and share it in the follow-up.
Thanks, Jessica. So next question, and I think it's a really, really good one. I'm going to look to Carrie and Robert again on, is after the second vaccination dose, do workers still have to distance and wear masks?
Trying to get off mute there. I can start, Carrie. Right now, I would say, yeah, definitely. Both post-dose 1 and post-dose 2, current public health measures are still required. As we progress a little bit further, we'll see if those things will change. But as of right now, while we're still in, I'm going to say the early stages of vaccine program rollout, and we're learning a bit more about what immunity truly means and protection means with these vaccines, public health measures will still be in place.
Thanks, Robert. And I'm going to just quickly give Gordon the last question that's coming up. This is asking about audio information that can be sent to workers via Messenger, WhatsApp, other ways of getting information to workers. So I'm going to give you the last question, and then we'll do a quick wrap up. Thanks, Gordon.
That's true last. Thank you, Lori. So I did respond briefly in the chat, but I'll just explain for everyone. On OFVGA's YouTube channel, we have posted voiceover videos of all of the written materials that have been created. So for anyone who wants to watch or I mean, they could just listen, that would be fine too. So those links could be shared. They're organized. There are playlists organized by language, so they're easy to access that way. The link to the YouTube channel is in the chat box, but you can also get to the video links through our COVID resources directly from our webpage as well. So if there's a specific resource that you think would be good for the workers to review, if it's available in video voiceover, there's a link next to the document link that would take you to YouTube to access. Thank you.
Thanks, Gordon. I just want to thank everybody for participating today. And I want to thank our presenters. You've done a great job, and we've had some really good questions come up today. Janet, I know we did run out of time to be able to loop back with you, so I'm going to connect you with Service Canada to make sure you do get a chance to ask about those questions related to CERB. But I did just want to remind everyone that if you do have any questions, you can always reach out to the OMAFRA labor email address at omafra.labor@ontario.ca with any of your questions. And then of course, there will be a recording of this webinar that will be shared and made available to you along with the questions that have been asked. So I just do a last thank you to everyone and thank you to our presenters. I think a lot of great information was shared today and I hope everyone enjoys the rest of their day. Thank you.